Welcome to the Center for Advanced Reproductive Services at the University of Connecticut Health Center. This video is intended to give you a basic overview of the steps that generally occur in the IVF process. At the Center for Advanced Reproductive Services, our sole focus is on providing the highest standard of individualized clinical care to people experiencing infertility in an environment that is caring, sensitive, responsive, and knowledgeable. We understand the emotional and healthcare needs of infertile couples, and we focus on what they want most, a baby. We have expertise in the latest technologies and treatments in infertility. We also offer the compassion and support services that will help couples cope with the special emotional needs in dealing with fertility problems. Our highly trained, compassionate staff will help each step of the way, and will start by giving couples the hope, support, and medical care they need to conceive. This video is one small part of an ongoing educational series that we hope will help to educate and inform you about the IVF process. During the process of IVF, a woman's ovaries are stimulated with medications to cause multiple eggs to develop. These eggs are removed from the ovaries through a procedure called egg retrieval. The eggs are then fertilized with sperm in the lab, and embryos are produced. After the embryos have grown and developed for a few days in our lab, they're ready to be placed into the woman's uterus. The procedure of placing an embryo or embryos into the uterus is called embryo transfer. Leftover embryos that may have been created may be frozen to be used in the future. The process of freezing embryos is called embryo cryopreservation. The first step in the IVF process is ovarian stimulation. The same hormones that are produced in the body during a normal menstrual cycle are used for IVF. FSH is used to stimulate the ovaries to have follicles containing eggs develop. During the menstrual cycle, only one follicle with an egg in it typically develops. Since the goal of IVF is to have multiple follicles with eggs develop, the dose of the FSH medication that is used is higher than what is naturally produced by the body. LH is also used sometimes during the IVF process to stimulate the follicles to grow. Since the goal of IVF is to be able to remove the eggs from the ovaries, it's important that a woman does not ovulate the eggs before her egg retrieval procedure. To prevent this from happening, medication is used to prevent ovulation. Some of the medications that are commonly used for this purpose are Lupron, ganirelix acetate, or cetrotide. Human chorionic gonadotropin, or HCG, is commonly used to help the eggs mature and prepare them for the egg retrieval procedure. The egg retrieval is performed under ultrasound guidance using an internal or transvaginal ultrasound probe, which is placed in the vagina. During the egg retrieval procedure, the follicles are visualized on the ultrasound screen, and a thin needle is slowly advanced into each follicle. The fluid in the follicle and the egg are aspirated and collected into small test tubes. The photograph on the left side of the screen shows an ultrasound of an ovary with follicles during an egg retrieval procedure. The egg retrieval procedure is performed with anesthesia called IV sedation, which is administered by a licensed anesthesiologist. Patients are given medication through an intravenous line that helps them to fall asleep for this brief procedure. Care is taken to ensure that patients are very comfortable prior to beginning the procedure. It's typically painless. After the procedure, cramping may be experienced, but is typically mild and brief. Patients are given pain medication in the procedure room to minimize pain and cramping. There are two ways in which the eggs may be fertilized. Standard insemination involves placing the eggs and sperm together in a petri dish. Intracytoplasmic sperm injection, or ICSI, is when a single sperm is injected into an egg. ICSI is often used in cases of male factor infertility and in unexplained infertility. Your doctor will make recommendations for the fertilization procedure that it's most appropriate for you based on your history and test results. Prior to the actual embryo transfer, a trial transfer, or mock transfer, is performed in the office. This is typically performed before the cycle is started. A trial transfer takes just a few minutes and is a good way to ensure that the actual embryo transfer goes as smoothly as possible. The embryo transfer procedure is performed using an ultrasound that is placed on the abdomen. The upper diagram shows the transfer procedure. The lower photograph is an ultrasound image of the transfer procedure. The large black structure at the top of the screen is the bladder, which is full of urine. It helps to outline the uterus, which can be seen below the bladder. Patients are offered a Valium tablet to take before the embryo transfer to help them relax for the procedure. After the transfer, patients rest in the recovery room, then continue to rest at home for 24 to 48 hours. On the day of your embryo transfer, the best quality embryos will be selected for transfer back into the uterus. If there are leftover embryos that have developed normally and are of good quality, these may be frozen for later use. Only normal-appearing embryos are frozen. If embryos are not suitable for freezing on the day of transfer, they may be observed in the lab for 2 to 3 days. If they develop normally and make it to the blastocyst stage, they may then be frozen. A cycle using thawed embryos is much less complex and expensive than a new fresh cycle. If a patient or a couple does not want to freeze embryos, a limited number of embryos will be created. The number of embryos that they're planning to have transferred will equal the number of eggs that will be exposed to sperm. In order to achieve a successful pregnancy with IVF, the steps that are critical to the process are having a good response to the ovulation induction medication, successful fertilization, healthy embryos for transfer, a positive pregnancy test, appropriately increasing levels of pregnancy hormone, and confirmation of pregnancy in the uterus with a fetal heartbeat on ultrasound. At the center, we hope that each and every one of our patients has success, and we do our very best to achieve that goal. The Center for Advanced Reproductive Services is dedicated to advanced infertility treatment through the combined application of high-quality patient care, clinical education, and research. At the center, we strive for excellence in patient satisfaction and clinical outcomes in a responsibly managed environment. Learn more about us at yukonfertility.com or call us at 860-679-4580.